Summary question. We are firmly in the middle of a psychedelic renaissance, with substances long regarded simply as recreational drugs, such as psilocybin, LSD, and MDMA, being reappraised as potential treatments for a number of mental health conditions. So, you're seeing the rebirth, renaissance, rebirth of psychedelic. Why? Because substances long regarded as recreational drugs, the people just take for the sake of it, now are being reappraised. They're evaluating it and are finding them or are branding them as potential treatment for accepting, reappraising their value as treatment drugs. At the same time, so one, there's a reappraisal that these may not be just entertainment drugs, they can be used for medical treatment, psychedelic drugs. At the same time, legislation and stigma surrounding psychedelics have slowly begun to loosen in recent years, and it increasingly looks like it might shake loose altogether. So, the stigma attached to the psychedelics is slowly going down. It might totally go. Now, all of a sudden, within the past year, the pendulum has swung all the other way. So, now suddenly, anti psychedelics, the pendulum has swung towards an appraisal, valuing psychedelics as a form of medical treatment, removing the social stigma attached to it, right? These are the three. While psychedelics were being reappraised as potential mental health treatments until recently, they have fallen out of favor within the past year. Exactly the opposite. He says slowly the reappraisal happened. They are being seen as potential medical treatment, potential treatment for mental health illnesses, and the pendulum has swung with the stigma attached to psychedelics slowly going. So this is exactly the opposite. With reappraisal of psychedelics as potential treatment and the stigma loosening, the pendulum is swinging the other way, meaning with the treatment of psychedelics as potential treatment and the stigma loosening, the pendulum is swinging the other way. In what way? This has become a little ambiguous. The pendulum is swinging the other way to what? Earlier, so you have to say that earlier there was a stigma, now the pendulum has swung the other way. Right? Here, we are not sure if he is talking about this happening, pendulum has swung the other way means the whatever changes you're talking about, potential treatment and loosening, now the pendulum has gone to the other side, maybe the opposite is happening. So B seems to have picked up all the words from the passage, and I'm not sure what it means to say. Are you clear that the option is saying that now the pendulum has swung the other way in terms of the way people looked at psychedelics and the stigma attached to psychedelics? B doesn't do that. Okay? While things had gradually started looking up for psychedelics as potential mental treatments, the negative opinions present in the society have also become decidedly positive within the past year. Yes, this tells us exactly that one, psychedelics are being seen as mental health treatment options, and the stigma, the negative opinion attached to it, is also slowly changing to positive in the last 1 year. That's also important. So everything has been given as it has been described in C. B looks temptingly the right one, but it is ambiguously worded. And when you really look at it 2-3 times, you're not sure what it exactly means. It means swung the other way means these things have gone, reappraisal has gone and as a potential treatment, and the other one. Okay. Within the past year or so, the opinion has suddenly shifted from negative to positive. That's it. Suddenly, what about the reappraisal part of it? What about psychedelics being used as a potential treatment for medical issues, for mental issues? So, again, not properly phrased summary. So, the correct answer is C.